CVIS is a wonderful conference. We're able to get together from cardiologists, cardiac surgeons from different phases of training, different levels of experience, brought into one place, kind of really teaching everybody about different things, technology. And it's been a wonderful experience. Great to be faculty here. It's really an honor and a privilege. One of the things that we really highlight is the advances that we've had in cardiac technology over the past decade, and particularly over the last few years. It's been impressive. Very exciting field where the developments have increased. Not so much in just how we treat patients that are healthy, keeping them healthy, but also patients who have very sick hearts, patients who have severe structural heart disease. And it's been impressive to see all these brilliant minds with years of experience bringing in these technologies and their ideas together so we can all learn from them. It's a great conference. I think the biggest advancement that we've had so far in cardiology has been in the realm of valvular heart disease and structural heart. The level of advancements that we've had in technologies that we had no options just a couple of years ago has been dramatically improving recently, particularly in the field of how we treat aortic stenosis, in the field of how we treat mitral valve disease, with transcatheter therapies that were only science fiction just a few years ago, and they're now coming into fruition. It's unbelievable. So for them, it's now options that we didn't have before. Where before, the only option was a high-risk surgery that potentially was not something that we could offer them. But now, we have options in the setting of having a multidisciplinary team where we sit down with a surgeon, cardiologist, imaging teams. We're now able to focalize their care to make sure that they have the best treatment posture in the hospital that they did not have before. So it's a great opportunity for them. And being in Houston CardioVascular Associates, the largest private cardiology group in central part of Houston, it's been an amazing experience. To being in a group that has a tremendous amount of experience and a tremendous amount of ambition to providing the highest level of care for Houston. The things that we've been able to do with advancements in technology to be able to maintain an excellent level of care for our patients has been great. To the levels of research that we provide for them, the level of testing that we do in invasive and non-invasive testing and treatments, and provide them the care that they also receive and they need at the largest medical center in the world, in the Texas Medical Center in Houston. So it's an honor and a privilege to be a part of Houston CardioVascular Associates. Right, so Houston CardioVascular Associates has been in a great opportunity of growth. We've now grown to levels that we've never seen before. So to be able to keep up with those demands, we moved to a new space. We're now in our museo building on the 8th floor, and it's an opportunity for our patients to have everything that we've been able to offer them before, and even more so, with better patient care, with the highest level quality of care that we can provide them. And our patients have been ecstatic. The overwhelming great response about the new space. We have now our surgical center as well that they're being able to participate in. They've had great experience in there as well. We've been having our first patients in the surgical center. They've done really well. Everybody's been very excited. Our patients appreciate the opportunity to have excellent top-level care without having to necessarily spend a lot of time in the hospital. And they always comment on the high level of patient satisfaction. Telehealth has always been lingering around, but it finally received the boost that it needed to be able to reach our day-to-day patient care through the pandemic. And now we're able to use this in a more efficient and effective manner, now with the infrastructure that's been built in, to be able to provide care for our patients in this way. And our patients have been very excited about it. It's been an excellent addition to the day-to-day care that we have for our patients. So I think it's been a great addition that we've done recently. I think for our patients who require extra attention and for continuity of care, to be able to have us readily available in the setting that's appropriate to provide them the appropriate care, I think it's been an excellent response to it. And I think that our patients appreciate it. I think they've been very thankful for it as well. The overwhelmingly positive response. AI is exciting realm, not just in medicine, but almost in every industry, as you can imagine. And so it's been very exciting to see it's in its infancy and to see exactly where it's going to go. The ideas of how we can use the data better to reach our patient and provide higher level care is always our goal. So I think as we approach this new technology, our patients will understand that our highest level of care is going to maintain, and it's going to only improve their day-to-day access to this. I think one of the things that's important for young patients is to understand that their care doesn't start when they're 50, 60, 70 years old. It starts when they're 20. Make sure they have adequate access to care, which unfortunately is still a need in the United States and is in Texas. One of the things that's also important to understand is that screening is key. Just because you feel well doesn't mean you are necessarily well. So it's important to understand this. We have to target our risk factors aggressively. We know that the disease doesn't start when you're 50 or 60. It starts way earlier when you're in your 20s, younger sometimes. So we need to make sure that we understand what our risk factors are and target them aggressively. Screening for simple things that we need to be doing on a regular basis. We just do, unfortunately, as a system and nationally, we don't do it very well. Screening for our quote-unquote silent killers, high blood pressure, cholesterol, diabetes, those are key. And the earlier we detect them and the better we can treat them, the overall better that our patient will be in the long term. You know, a lot of us also maintain a great practice in general cardiology, and it is not very infrequent that we see young patients with a great concern, might have some symptoms, might have some family history, might even have some risk factors already identified. To better understand how they're doing, we can help target that in a primary prevention standpoint to make sure that their risk factors are aggressively evaluated and targeted to be able to help prevent them any issues down the road. The way that I explain this to my patients, my fellow colleagues, is that we are really, really good doctors. We really believe that.
Yeah, big.
But we also don't have necessarily the know-how to build a practice, not just on a local level, but on a grand level, at a national level. Our focus is to take care of patients. So we need the resources, we need the availability, we need the know-how to be able to help become an entity that is much larger than our local level. Even though we're the largest group in Central Houston, we want to always become a part of a larger player to be able to provide care to a larger sect, and also to learn from other great partners that we have nationally about best practices to provide lower costs, better healthcare, higher quality, higher standards, and learn from our partners who have developed great practices to be able to share these best practices options across our entire platform. And that's what I think is the beautiful thing about USHV, is we can now do that.